The root cause of the problem is the rising cost of health care. And there's a lot of things that can happen right now in government that can begin to affect the cost of health care. We have to deal with two things. We have to deal with hospitals and providers being more efficient and reducing the cost of health care that way. And there's a lot of things the government can do. For example, we've got 10% increase in pharmaceuticals. We have 12,000 pages of regulation in the last 2 years. We have lack of ability to consolidate and make healthcare systems more efficient. We do not have interoperability among electronic medical records so they can talk to each other. All those things could be addressed either administratively or legislatively by the government. On the other hand, we have a nation that is getting sicker all the time. We have an epidemic of smoking. Still 16% of the people in the United States smoke, the major cause of cancer of all types that's preventable. And we could tax cigarettes to the point where people wouldn't buy them. The second thing is we have an epidemic of obesity. That accounts for 10% of the healthcare costs in the United States, and a third of the United States is obese, and it's getting worse. And we continue to subsidize the growing of sugar, for example. And finally, we're dealing with a terrible epidemic of opiates, which we really need to address. And I don't think most people in the United States recognize the magnitude of the problem. This year, there'll be 62,000 deaths in the United States, which is more than the total deaths of 58,000 in the entire Vietnam War. And this is planning on going all the way to 90,000 is predicted over the next 3 years. So those things are costing us a lot of money, and they're all getting worse. And until such time as we begin to address those issues, we're going to have a rising cost of health care.